Hello, my name is Mackenzie Salt, and I am a postdoctoral fellow at McMaster University and Autism Alliance of Canada. This is a presentation that was supposed to be part of a panel at the Autism Research Center's Practical Tips Conference. However, I was unable to present at that time due to external factors, so I've recorded my presentation here. I will be presenting today on the topic of autistic adults in Canada. I would like to acknowledge the funders of this project, the Public Health Agency of Canada, the Canadian Institutes of Health Research, and the Azrieli Foundation. The Canadian Academy of Health Sciences report that Dr. Zwagenbaum spoke about identified many gaps in our knowledge about and understanding of autistic adults, including we don't know the prevalence of autism in the adult population in Canada. We don't know about autistic adults' quality of life, what they go through in their daily life, and what are their needs. There are not many services for autistic adults in Canada, and few of those, if any, are publicly funded. Previous outreach to autistic adults in Canada has been limited. Outreach is focused on input from caregivers about children or professionals. Following the mantra, nothing about us without us, a common phrase in the autistic community as well as the disability community more widely, I worked with 8 other autistic adults and 1 autism parent to co-design and co-develop the Canadian Autistic Adult Needs Assessment Survey. This survey was a hybrid survey containing both quantitative and qualitative questions, 97 questions covering 11 areas of life. And this survey was specifically aimed at autistic adults in Canada aged 30 years or older. This demographic was chosen because the little autism research focusing on adults that there is tends to focus on the 18 to 29-year-old demographic, and the needs of an 18 to 29-year-old can be very different from the needs of someone 30 plus. The survey was as I mentioned earlier, the survey was co-designed with lived experience partners. So there was myself, an autistic adult, as well as 8 other autistic adults and 1 autism parent. And with this group, there were a variety of ages, genders, and abilities present. This allowed us to focus the survey so that it wasn't targeted at one particular demographic or one particular intersectionality, and that it was acceptable to multiple people covering multiple facets. The initial survey draft was developed using quality of life instruments that had been used before with autistic adults, older adults, and adults with disabilities. And the initial survey draft was about 60 questions. The survey went through 4 iterations before being finalized, and with questions being added, removed, many questions from existing questionnaires had to be reworded, as sometimes they were confusing, or due to being removed from the context of a larger questionnaire, sometimes they didn't, their rating scales didn't make as much sense on their own. The survey was also made longer and more comprehensive. The thinking behind this from the lived experience partners was that it was better to have one comprehensive survey rather than specifically leaving gaps and necessitating further surveys down the line. And then a section on transportation was also added. The survey was open for 2 months and was advertised through social media and 15 dissemination partner organizations. The survey was primarily online, with paper and phone options being provided for accessibility. The median survey completion time was approximately 45 minutes. 1,915 people responded to the survey, and the survey was open to people both with an autism diagnosis as well as those who identify as autistic but did not have a diagnosis, a group that isn't always included in research but is valuable to hear from. And respondents could choose to be compensated for completing the survey. Now, talking about who completed the survey, 55.1% of respondents had a formal autism diagnosis, and almost 3/4 of respondents were between the ages of 30 and 44 years, with 1.9% of respondents being 65 years or older. The oldest respondent was 78 years old. 73% of respondents identified as female at birth. This is particularly significant because autism has a known sex disparity in that between 2.5 and 4 times more males are diagnosed with autism than females. So having a large group of autistic females that aren't necessarily included in research at the same rates as males is valuable to hear from and valuable to learn from their experiences. 65.5% of respondents had completed a college diploma or university degree. 68.8% of respondents identified that they had some level of support needs. 41.7% had low support needs, 24.8% had moderate support needs, and 2.3% had high support needs. So in summary, our sample was well-educated, employed, financially well off, had lower support needs, were younger, mostly female at birth, and mostly white. Now I'll be talking about key takeaways from specific sections of the survey. The process of getting a diagnosis is not always straightforward, and there can be a number of barriers that can get in the way of seeking a diagnosis. 65.8% of respondents with a diagnosis were diagnosed as adults. 51.4% of diagnosed respondents indicated that receiving a diagnosis had a positive impact on their mental health. 67.5% of diagnosed respondents indicated that receiving a diagnosis had a positive impact on their understanding of their personal identity. 79.1% of respondents without a diagnosis would seek one if there were no barriers. The most frequent barriers to getting a diagnosis were cost, with 66.2% of respondents without a diagnosis indicating that as a barrier. Lack of nearby diagnostic professionals who can assess adults, with 36.3% of respondents without a diagnosis selecting that option. And lengthy waiting lists for assessments was chosen by 36.3% of respondents without a diagnosis. The financial picture of survey respondents is characterized by significant gaps in financial health. 56.2% of respondents did not have any retirement savings. 42.7% did not have short-term savings. 25.4% did not have enough money for the things that they need. 68.3% spend more than 30% of their monthly income on housing, or their housing costs are paid by someone else. This is compared to 21% of homeowners and 33% of renters in the general Canadian population. 60% of respondents who are not working did not have sufficient supports to help them find a job. The health profile of autistic adults in this survey reveals significant challenges. Almost 85% of respondents have recurring or chronic health conditions. 41% of those respondents indicated that they have over 5 types of chronic conditions. Over 60% of respondents rated their mental health as fair or poor. 74.7% of respondents do not have sufficient access to mental health services to completely meet their needs. And 71.7% of respondents do not have sufficient access to counseling or coaching to completely meet their needs. In conclusion, there's a significant role for government in supporting autistic adults. The data from the survey provides a starting point for a national autism strategy to address the needs of autistic adults across Canada. More research is needed to capture the needs and experiences of other autistic people that we were unable to reach in large numbers in this survey, including those with higher levels of support needs, older autistics, those with lower levels of educational attainment, and members of ethnic or visible minorities. I would like to thank my team at Autism Alliance of Canada and McMaster University for their work in putting this together. I would like to thank all of the lived experience partners who put in time helping to develop this survey. I would also like to thank the people who filled out the survey, the Autism Research Center for inviting me to speak, and all of you for listening. Thank you very much.